Hi, my name is Dr. William Brooks, and I'm here today to talk about spondylolisthesis. And that's a very fancy word that really just means that the spine has slipped out of position. And I'm holding here a lumbar model, and really what spondylolisthesis means is that the bones have slipped out of position where they should be lined up, and then they've gone either anteriorly or forward or backwards or in retrolisthesis. And what happens is that you can get a spondylolisthesis from a number of things. Most commonly it's from a degenerative nature where the disc here wear out or the joints in the back or posteriorly wear out, and you get instability or motion in this level, causing it to slip backwards and forwards. Now when people present to my office or clinic with this, they often complain of back pain, they often complain of leg pain or numbness or weakness. And as those symptoms worsen, this can become really debilitating and make it difficult to stand or walk. And patients state that they need to sit down more or they're not as active as they'd like to be. The first thing that we do when we come to the office is obviously we examine the patient after speaking with them. We'll obtain some basic x-rays to look at the issue. Often the next step is to get an MRI and look at it more closely. Treatment for spondylolisthesis can begin as basic as simple medications such as anti-inflammatories, Tylenol, muscle relaxers, even into some light pain medicines or even an occasional opioid medicine, which we try to avoid because of the addictive properties. Past the medications, often physical therapy is the bedrock of treatment because oftentimes therapists can reduce the symptoms that surround the spondylolisthesis and make them less symptomatic, like let the patient be in a more comfortable position, make them be more active. If that doesn't work, then often the next step in the treatment algorithm or treatment for a spondylolisthesis is epidural injections. Now these are cortisone or steroid injections which place the medicine around the irritated nerve roots where we can calm them down and hopefully make the symptoms better. Oftentimes we'll try 1, 2, or 3, and if they're successful, then we'll simply monitor the situation with x-rays over time, over every year or so, and make sure that everything is stable. If injections are not successful, then we would do a surgical consultation and we would discuss what is the appropriate surgery to treat this spondylolisthesis. Now there's many minimally invasive techniques that I use that I really do enjoy and patients do very well with. You can do a minimally invasive posterior spinal fusion where you make 2 small incisions and you microscopically decompress the nerves and take the pressure off, and then place screws like here through small incisions and place some bone graft in the disc space, fusing these levels together. And that's one technique. Another technique is to come from either the front or from the side and place the inner body cage or spacer, as we say, to really restore back the natural height. Because if the bone has slipped forward and you place a spacer, it restores that height and maintains it in position. And these are often surgeries that take under 2 hours. The patient is either done outpatient at our own facility here at OrthoGeorgia, or this is a one-night hospital stay and they're up and back walking on their feet the next day. It's really one of the diagnoses that I enjoy treating because people do so well with either non-operative or operative treatment. It's something where if you can make someone who can't walk or stand or have numbness or weakness, make their legs feel better and stronger, they're often very, very happy patients, and really, we enjoy seeing them. If you have any of these symptoms or any of these concerns, just call us here at OrthoGeorgia.